Welcome to the Deep Dive. Today we're tackling a really complex piece of the U.S. healthcare puzzle, pharmacy benefit managers. PBMs. You hear them mentioned a lot, often as maybe the biggest reason prescription drug costs are so high. But honestly, most people don't really know who they are or what they do. They can kind of operate behind the scenes. So our mission today isn't to, prove or disprove anything definitively. Instead, we're going to walk through a set of materials, source documents from groups that are highly critical of PBMs. We want to understand how these critics see PBMs, their history, how they work, and frankly, some pretty explosive allegations against them. Think of it as a way to quickly get up to speed on one very complicated and very expensive part of your healthcare.
Yeah, and it's crucial stuff because their reach is just enormous. PBMs handle the pharmacy benefits for, over 253 million Americans? That's most people with insurance. And the story these critical sources tell is, well, it's quite a story. They say what started out as a pretty straightforward admin job processing claims has supposedly ballooned into these, three massive, incredibly powerful, and hugely profitable companies. And the allegation is they're now focused almost entirely on their shareholders, not necessarily on patients or the employers paying the bills.
Right, and that consolidation point you mentioned is wild. These sources highlight that after years and years of buyouts and mergers, just 3 PBMs now control, what was it, 78%?
70%,
Of
yeah.
all prescription drug benefit transactions in the entire country.
Yeah.
That level of market power in something so essential, it's hard to wrap your head around. Okay, so let's maybe start at the beginning. PBM 101, the origin story, according to these critics.
Sure. So according to these sources, it began pretty simply, benign even. Back when health plans first started adding prescription drug coverage, they realized pretty quickly they weren't equipped to handle millions of small claims.
Made sense. Too much paperwork, too complex.
Exactly. So they needed someone else to do it, a claims processor. And that role, well, it evolved into the PBM.
So it was just a basic service arrangement at first?
That's the picture painted, yeah. The plan sponsor, like an employer, paid the PBM a small fee. The PBM handled the admin, processed the claims, made sure the pharmacies got paid, helped patients get their meds.
Okay. Seemed to work for everyone initially. Patients, employers, the processors themselves.
But then, according to these critical sources, comes the turning point. The argument is that these middlemen, the PBMs, they started to realize just how much control they had over the money flow, over patient access, and as they got bigger, many went public, which meant bringing in shareholders.
Shareholders who expect profit growth. Gods to grow.
Precisely. And critics argue that's when the focus shifted, from just providing a service to, maximizing profit from every single prescription transaction. That's why some critics, kind of bitingly, now call them pharmacy benefitless managers.
Benefitless, ouch.
Yeah. The claim is their main legal duty shifted to shareholders, putting them potentially at odds with the patients and employers who hired them precisely to save money.
Which really sets up this fundamental clash, doesn't it? This core contradiction. PBMs market themselves very aggressively as the ones keeping drug costs down, right? They tell employers, we use our size to negotiate lower prices.
That's their whole value proposition. We are the controllers of cost in the supply chain.
Yeah.
But the sources we looked at, they basically say, that's a nice story, but it's just a story.
Okay.
And that leads us right into the numbers, the financial data these critics use to argue the exact opposite, that PBM practices actually drive up costs.
Right. This is where it gets really interesting looking at the trends. If PBMs are supposed to be controlling costs, the critics ask, why have total prescription drug spending in the U.S. gone up? I mean, it's an insane number, 1,000% since 1987.
1,000%. And you really have to see that in context, right? Because over that same period, the entire U.S. economy, like GDP, grew about 126%.
Okay, so drug spending grew nearly 8 times faster than the economy overall. That's quite a gap.
It is. And it makes you question the cost control narrative pretty hard.
Plus, it's not just the total spending. The sources also point out that what people pay out of pocket, your copays and deductibles, that's also jumped significantly, about 169%.
So the argument goes, if PBMs are saving employers all this money, why is the total bill exploding? And why are individuals feeling more pain at the pharmacy counter? Doesn't add up, they say.
So where do the critics say the money is going, if not to lower costs?
Profit extraction. That's the core allegation. They argue that even with huge savings from generics becoming available, and even with manufacturers paying out way more in rebates, money that should theoretically lower costs, PBM profits have just gone up and up, exponentially.
So the claim is they're not just failing to control costs, they're actively adding to the cost burden through their own profit-taking.
That's the essence of the criticism, yes. That their complex business model allows them to pull profit out in ways that inflate the overall price tag, the opposite of their job description.
Okay, let's